The doctor at the IVF program tells them that they have a 93% chance of having a healthy child and a 7% chance of having a child with genetic abnormalities. So the woman goes back home, they talk about it, she decides she doesn't want to be married anymore.
Oh.
She can't deal with that 7% chance of a child with a genetic abnormality. She leaves him.
Dating me is a blessing and a curse. I've got a reputation for being the sex toy person, and somehow my parents are still so proud of me, and I don't get it.
Check your ego at the door, okay? If having a vibrator and you gives her more pleasure and more orgasms or more intense orgasms, then so be it.
So gentlemen, listen up to this podcast.
I call it the most circuitous route ever to being the CEO of a sexual wellness company. He goes, I developed a solution for PE. I go, you developed a solution for physical education? Because when I was in school, PE was phys ed. He's like, no, dumbass. Any man will tell you there's never been a time where at least once or twice in his life, you're acutely aware of you're getting near that point of no return, inevitability, and your partner's not finished yet. And there's that little guy on one shoulder going, oh, this is going to feel so good. You want to finish? And there's a little guy on the other shoulder going, not yet, you idiot. She's not done yet. The rage now in sex toys are male masturbatory products. I get a phone call, one of my very good friends, his wife is a nurse at Hoag Hospital. He goes, you sitting down? I'm like, yeah, in my office. I go, why? He goes, Ron got shot. I go, is he okay? He goes, no, he died.
Welcome to Fertility and Other F Words, the webcast that tackles fertility, sexual health, and everything in between. I'm Dr. Amy Pearlman, board-certified urologist with expertise in sexual, hormonal, and genitourinary health, and co-founder of Prime Institute in Miami, Florida.
And I'm Dr. Larry Lipshultz, professor of urology, Baylor College of Medicine. I'm a board-certified urologist and also director of the Division of Male Reproductive Medicine and Surgery.
So Larry, tell me about an interesting case this past week.
Okay.
Anything good?
It's not good,
okay,
but it is interesting.
All right.
It raises some interesting questions.
All right.
So this is a 38-year-old gentleman who comes to see me for infertility evaluation. Now, interestingly enough, he's no longer married. And that in itself is worth discussing. So he's 38 now. Previously, when he was about 32, 33, he was not dating anybody. And he's a very shy Indian guy, works as an accountant. So he contacted his parents. I'm sure he speaks to them quite frequently, who are in India. And they found him a wife. Whether they went through a matchmaker, I don't know the details, but he found him somebody who he had never met before. Whether or not he went over and married her or whether she came here and got married, I don't know that.
Okay.
But they got married, right? Kind of strangers, and they got married.
Well, the typical arranged marriage situation.
Yes. Yeah. So, which I didn't even know they still did.
Yeah.
So 3 years, 4 years, she's not getting pregnant. So they go to an IVF program to get an evaluation. The IVF program does a semen analysis. His count is like 1.5, 30% motile, really bad semen quality, which should have been investigated at the time. Mm-hmm. The doctor at the IVF program tells them that they have a 93% chance of having a healthy child and a 7% chance of having a child with genetic abnormalities. So the woman goes back home, they talk about it, she decides she doesn't want to be married anymore.
Oh.
She can't deal with that 7% chance of a child with a genetic abnormality. She leaves him. So here he is now going through this whole thing with her, and she walks out. She's already remarried 1 year later.
Oh, my goodness.
I know. He, of course, still now is no longer dating and is just so remorseful about these previous years that have gone by. And I looked up the statistics. So the statistics on a woman her age married to a man his age, otherwise both of them healthy, with a sperm density of about 1 million, the chance of a genetic abnormality in the child is 1 to 2%.
Oh, my goodness.
Not 7%. Mm-hmm. So, I mean, bad statistics, bad information, they got divorced.
Wow.
I think the guy's better off, though, because if she left that fast,
right.
I mean, she didn't care about him.
Yeah, I mean, that goes to show that the information we provide patients really matters.
Very impactful in what they do.
Mm-hmm. But maybe that wasn't the full story.
Why not?
What?
Why not?
I don't know. I mean, that one number ends the relationship?
Yes. I can see it.
Do you see that in other patients?
No, but yeah. Given this situation, they don't even know each other.
Yeah.
I mean, I think there was a relationship issue because they didn't have a relationship. Mm. And I think the infertility just kind of was the last straw.
Yeah.
I don't think and like you say, maybe there's more. I think the more is the fact that they shouldn't have probably gotten married. I don't know what the success rate is of these arranged marriages, but I think there's a big taboo about getting divorced. So, but she didn't waste any time leaving when she found out there might be a problem.
So
and I felt so bad for him because so now, we're going to do an infertility workup, but I mean, he doesn't have a partner.
Yeah.
I mean, is he going to go back to his mom? I don't know what's going to happen with this poor guy.
Yeah.
And that's why it was a really sad patient for me.
So let me ask you this, because you see couples all the time coming in with infertility, and the mental drain that whole process puts on a couple has to be draining for their entire relationship. How often do you see couples that come in, they're together, they kind of go through this infertility journey, and sort of by the end, their relationship is like never the same, and maybe they, break up?
I don't think it's uncommon. I don't have the data. I think it would be very interesting for someone in the social science space to find out what this data is, but I think it's high. I think there's a high rate of divorce in couples who go through infertility and are unsuccessful.
Well, that's interesting.
And I think, again, it's a case of blame. Now here, it clearly was related to him. But we've seen couples here already who, have a shared responsibility and kind of get each other. But this was not a good situation.
Yeah. So much in sexual medicine and sexual health, it is a shared responsibility, right? Whether it's between a husband and a wife, a doctor and a patient. And that's kind of dovetails into a story that I want to tell you about a recent patient that I saw. So this gentleman is very young. He's 21 years old. I don't see adolescents, but I will see guys who are, 18 and above in my office. And it's not uncommon that I see young guys in my office. I think that takes a lot of bravery, I think, to show up in an office like mine. Not only to show up that young to talk about sexual health concerns, but I'm like a young-ish, like -ish woman, right? And so I think it's particularly...
Am I your reference point here?
I think it can be particularly challenging for young men to see someone like me.
Embarrassing.
And embarrassing, right? And so one of my biggest, missions...
What was he complaining of?
So when he was 16 years old, he was in a relationship, and he says it was a very toxic relationship, okay? So he was put on an anti-anxiety medication at the time. And mind you, he has a lot of anxiety concerns throughout his family. So he was started on a medication called sertraline. And towards the end of their relationship...
Is that an SSRI?
An SSRI medication. Towards the end of their relationship, he wanted to get off that medication, right?
Do you just want to tell the viewers what an SSRI is?
Yes, absolutely. So an SSRI medication stands for Selective Serotonin Reuptake Inhibitor. So it's one of these medications that is very commonly used to treat men and women who have anxiety or depressive symptoms. And these medications are wildly prescribed around the world. And I'll talk to you a little bit about some of my concerns, but this is one of the concerns that I had with this patient, or that he had actually a couple years ago, is when he stopped the medication, or towards the end when he wanted to come off the medication, he started noticing reduced libido. And his girlfriend at the time was wondering, why is his libido changing? He's not as interested in having sex anymore. So he gets off the medication, and now his concerns are he doesn't want to engage in intimacy. He has erectile dysfunction, and he has some loss of penile sensation. And he just no longer has that itch he needs to scratch, right? And he is in the midst of really developing as a sexual person. So he goes online, and it's so interesting, Larry, because we have so many people that go online, and they go on Google, they go on ChatGPT, they go on Open Evidence and Reddit, and they bring information to us.
And they go to Dr. Google.
And they go to Dr. Google, and they bring information to us. And I think a lot of the responses from people like us is to say, why are you going on there, right? I have a different response, and I'm curious what your response is. I love when my patients come in educated. I love when they come in and they say, Amy, I had a little discussion with ChatGPT, and I want to tell you about it, right? Because honestly, in a lot of ways, ChatGPT is great. In a lot of ways, the internet has a lot of fabulous resources, and it allows my patient to get educated on the foundation so they can come in, and I've defined my job as helping them understand what we have, data and research to say whether or not that's true or false.
But you see, I think the issue here is not that I have a problem with people looking up information, but most people do not have the skill set to know what's good information and what's bad information. And so, I think that ChatGPT, and especially Open Evidence, because it's JAMA and New England Journal based, is reputable. But a lot of these blogs they go on, or these chat rooms they go on, they get bad information, and they come with a preconceived concept of what's wrong with them that you have to break. You have to like undo all the bad.
Yeah, that's true.
So I think it's a blessing and a curse.
Right. So let me clarify. I think it's great to help build a foundation, but not to understand the nuances of what they're coming in with. So this guy like looks online and he is concerned that he has PSSD, which stands for post-SSRI sexual dysfunction. I don't know about you. I never learned that in any of my training. I only heard about that condition when I was actually working at the University of Iowa. And I had a young man reach out. He lived in Minnesota and he sent me an email and he had seen just some of my online content and he described his story in an email. He took Prozac for a couple of days, which is another SSRI medication. And now he can't feel his penis and he has no, desire to have sex, his ejaculatory volume change, a host of other symptoms. And so I got on a Zoom meeting with him to learn more about what he was experiencing. Because when patients tell me something is going on, we may not always be able to understand or describe it, but I have to believe my patients. So he kind of put me down this rabbit hole where then I started doing research on this topic, right? About PSSD, post-finasteride syndrome, post-Accutane syndrome, and realized there are people all around the world that are concerned that they have these conditions. And here's where the problem lies, Larry, is we so often put our patients on medications, any medication you can think of. We tell them as part of this informed discussion, if these are the common side effects that can happen. If they happen and they're bothersome, we can always stop the medication. The side effects will go away, right? Easy peasy, that makes sense. But Larry, what if the side effects don't go away?
I know, but see, but this is a very, very minute number of medications. I mean, it's 3 medications.
Well, 3 classes of medications.
Right,
3
but
classes of
Accutane's a medication.
Yeah.
And
but tons of SSRIs.
Yeah, but that's the one that has a lot, not the finasteride.
Right. Well, so we're going to definitely hit on that topic of finasteride during a later episode.
Right.
We all have our own
biases.
Patients come in with different stories and different experiences. I'll tell you, some of the most thoughtful people I've ever encountered in my entire life, or they're like researchers and scientists from around the world, and they said, Amy, I took this medication, and they'll go to their doctor, and their doctor will say, oh no, you're just depressed, that's why you have ED, and they say, Amy, I know what it is to be depressed. I've been depressed before. This is different,
Okay, but what happened to this poor guy?
So this guy, he had these symptoms. So he sees me a couple years later, and now we're trying him on a lot of different medications because he's 21 years old. He's a football player. He wants to enjoy college, and he's having issues in his relationships.
But did his symptoms ever get better?
Well, they are getting better with medications, but for several years they weren't getting better. Right. And you can imagine a kid like that at his age, it's hard for him to talk about this with anyone, including his parents. So he's currently on this regimen of Wellbutrin, buspirone, and those medications. So this whole process, right? So we mentioned the SSRI medications that increase serotonin in the body, but there are also, you have like excitatory factors and inhibitory factors when it comes to the sexual response, right? The the 2 thumbs up ones are really going to be things like dopamine and norepinephrine, and the inhibitory one is serotonin. So you can imagine that these SSRI medications, I mean, we see this all the time. Guys who are on SSRI medications, they come in, they're like, doc, I can't climax.
Right, but usually it's transient.
Yes, we don't know the prevalence of the SSRI issues.
Right.
That's the issue. And we can't predict in whom these side effects will happen, right?
But it's a good class of drugs for what it's used for.
It can be helpful.
Yeah.
I think one of the problem lies is we have to have informed consent with our patients. And so I'll role play with you here, for example, right? Because I had a patient that came in, he said, hey, I'm a little anxious. What do you think about me starting an SSRI, right? I would say SSRI medications can be very helpful for the treatment of anxiety and or depression. They can have sexual side effects in a good number of people, right? In some subset of patients, people can have sexual side effects that include loss of sensation to the genitals, reduced ejaculatory volume, lower libido, difficulty reaching climax, erectile dysfunction. In some patients, even after stopping that medication, those side effects can persist. And I don't know how to predict in whom that will happen. Is that something you're willing to, take on? And some patients are willing to take on that risk. I've encountered a lot who aren't. I've encountered a lot of patients that say, I was a little bit anxious. I wasn't that anxious. It wasn't that bad.
Okay, so if the person is very anxious, what would you go to?
Well, so there are medications that have less risk of causing these issues.
First of all, let me back up. Would you treat the anxiety or send them to somebody?
Oh, so I would definitely send him to somebody, right?
Me too.
So I would definitely send him, to a psychologist.
Is this guy in psychotherapy or anything right now?
He is, because he has a therapist that's managing these medications. I wouldn't manage these medications for him. It's out of my area of expertise. So he's currently on Wellbutrin and buspirone. And both of those medications, they work on the serotonin, dopamine, norepinephrine pathways. They are less likely to cause sexual side effects and sometimes can make it better. So that's kind of like some of the foundation of what we're trying to do. And then I also have him on Cialis to help with his erectile function. And then he's on a medication. We had him on cabergoline, and you've used that medication before. You've published on that work.
I use cabergoline.
Using it in men who have difficulty reaching climax.
Right.
And so I used to use that medication a little bit more, but I get a mixed bag. I mean, your papers show that it can show benefit. Like, what's been your clinical experience?
It can show benefit.
Yeah.
But I can't tell you how often. It's not a slam dunk.
It's not a slam dunk.
No, I mean, you can't give it and say, I know this is going to work.
Yeah.
It's certainly better than 50%.
Yeah. So I tried him on that medication, wasn't doing the trick. So he asked me about Promescent, which is a medication that's used in Parkinson's patients. And there's some literature out there using that medication. So for his issues.
All of them? Or for
his sexual health, arousal, and the orgasm response.
Yeah.
So he's been on that medication.
How about bremelanotide?
So I like bremelanotide a lot, but it's an injection, and he's 21 years old. And so we're not starting there. He wanted to try pills.
Yeah, but I think this one, at least, you have more reason to think maybe it'll help.
Yeah. But he's got some good response with Promescent.
Oh, really?
Yeah. So he feels like he gets more of an urge to masturbate and watch porn. And I think most people would say, no, don't watch porn. And I'm like, wait a second, not all porn is bad. And if you feel now you're getting the urge that you want to engage in sexual activity, I don't know, I'm going to take that as a win.
See, the only patients I see who have been using porn are the ones who become almost addicted, but then when they have relationships with somebody kind of normal, they can't get aroused.
Right. And then they have delayed ejaculation.
Right. So, I mean, I don't know.
Well, I like that he wants to masturbate.
Yeah.
Like, that's a good sign, right? Mm-hmm. So he's doing better, which makes me optimistic. All these guys at CB...
I'm sure he never thought he was going to see a woman who was going to tell him that she's glad he's masturbating. Right? Never in his wildest dreams.
I don't know. He's a sweet kid, and we have great conversations. But it's really pertinent to today's episode, because we are going to talk about premature ejaculation today, and one of the mainstays of treatment. So first of all, there are no FDA-approved medications for the treatment of premature ejaculation. And, there are so many different ways that we can treat it, but no FDA-approved therapies. And literature would suggest that it is the most common sexual dysfunction worldwide. Extremely common, even more so than erectile dysfunction, right? And PE and ED oftentimes come, associated with each other. But one of the mainstays of therapy are SSRI medications. A lot of people use them.
Right.
I used to prescribe SSRIs for premature ejaculation, and I don't anymore because I'm worried about their side effect profile.
I still use Paxil.
Yeah.
But now after this session, maybe I will think twice. But I've not heard this whole thing discussed in detail about the permanent results.
Yeah. So what I want to talk about today on Breaking Bedside News is an article that actually you found on some other interventions to treat men with premature ejaculation. Shall we get into it?
Yes, please.
All right. So this article was published earlier this year in the Journal of Sexual Medicine.
Yes.
And they look
a decent journal.
Great journal. And they look at 3 interventions here. So they're looking at pelvic floor muscle training, they're looking at diaphragmatic breathing, and they're looking at behavioral therapy, which is typically looking at the start-stop method, right? Mm-hmm. And so they compared 2 groups. Group 1 was all 3 of those: the breathing, the behavioral modification, and the pelvic floor muscle training. Group 2 was everything other than the deep breathing.
What is the theory behind the pelvic floor muscle training?
Well, there's an ejaculatory reflex. And so what I tell my patients is they have actually incredible control over their ejaculatory, their experience, right? How long they can last and not last. They just don't know it yet. Right? And so there are ways that you can manipulate the pelvic floor muscles to manipulate the ejaculatory reflex. So that's part of the treatment.
For
right?
sure?
Yeah, 100%. So I actually, as one of them, we'll talk about the way that you treat these guys, the way that I treat these guys, but pelvic floor muscle, sending my patients to see a physical therapist is actually one of the mainstays of treatment. So
but you have to have somebody who understands the role of these muscles in ejaculation.
Correct.
Which I don't think they all do.
That's correct. So that requires a conversation with the physical therapist to say, hey, if I send some guy to you who wants to last longer, do you know how to treat that guy? Not just tell him to do Kegel exercises.
Exactly.
Because sometimes Kegels can make it better, sometimes it makes it worse, and the same thing with relaxation exercises, right? So in this study, I want you to look at page 2 here, second paragraph, and I want to demonstrate for the viewers here what this diaphragmatic breathing exercise was, because this is really the intervention that they were trying to compare between the 2 groups.
You're going to keep your clothes on.
I'm going to keep my clothes on.
I just wanted to make sure. All right. So I'm going to tell you what to do.
You're going to tell me what to do.
Okay. So while sitting upright.
And so, by the way, we haven't seen a video of what this actually looks like, but based on their description, this is what I think this exercise is.
You've not heard of this before?
I've not heard of this before.
Okay. That's interesting, though.
Yeah.
While sitting upright on a chair with shoulders relaxed and the pelvis in a neutral position, the patient was instructed to place their hands on both sides of the lower ribs. Okay. Take 3 seconds of inspiration through the nose and feel the ribs expanding outward and upward, followed by 7 seconds of expiration through the nose, feeling the ribs moving inward. You feel that? These exercises were repeated at least 10 times in each session, with 2 sessions per day, every day.
So notably, these exercises are not being done during sex, right? They're being
you
done
don't
during
think?
this 8-week period as part of this training protocol.
Yes.
And actually, what they found in both groups was they were able to increase the intravaginal ejaculatory latency time. So I find that measurement a little bit interesting, right? It's essentially you have to have the person get a stopwatch and measure time from the period that they enter their partner to when they ejaculate.
Yeah,
Can
I
you
mean, that's-
imagine being a
no.
participant in that study?
No.
Very challenging.
Maybe there's a third person in the room.
So I think it's really good to look at how long are we actually prolonging the time, right? Because something could be statistically significant, but not necessarily clinically relevant. So if you look at the differences in the results section here, group 1, which had those 3 interventions, including the diaphragmatic breathing, they increased the intravaginal ejaculatory latency time from about 2 minutes to 15 minutes. That is a huge
That's
increase.
significant,
That is clinically significant.
Right.
In the group that did the 2 interventions without the breathing, they were able to increase that from about 1.5 minutes to 10 minutes. That's also phenomenal.
Yeah.
So what I'm learning from this paper,
But I thought, no, but go over the difference in the group that didn't do the differences in the two group was 5 minutes.
5 minutes. Yeah.
Which is clinically significant.
Right. So I think that's important, but I think it's also important to know that like you don't have to do everything to get some benefit. You know,
Right.
1.5 to 10 minutes is great.
Yes.
And so what I've learned from this paper is in the guy who comes in with premature ejaculation, as urologists, we need to expand our toolbox, right? So we're going to get in today with our guest about one therapy in particular, a delay spray, which is a phenomenal therapy.
Especially if you combine it with some of these.
Exactly. Now, I haven't seen any research combining all of these therapies with a delay spray,
Right.
with some of the other
Right.
ones. But for guys who really want to prolong that time, I mean, we have so many tools in the toolbox. So maybe let's briefly go into what's your standard way of treating a guy who comes in who wants to last longer, and then I'll go through mine.
Yeah, well, I mean, yeah, but mine is tramadol, which is
a pain
which is a
medication.
narcotic-like medicine that they take 2 hours ahead of time, which works in some patients. And if that doesn't work, I'll usually go to Paxil, and I'll try it on an as-needed basis. Doesn't work that well, but I know I'll get a better effect if I go daily. The problem with daily is what you've said today, which I didn't know about, but also you can't cold turkey it. You can't just stop taking it, because if you stop taking it, you can get significant side effects, right?
Yeah,
Headaches,
absolutely.
nausea.
Yeah.
So those are, I mean, I don't, and then of course the Promescent spray, which we're going to talk about, that is a nice adjunct.
Yeah.
I don't like using it as the primary treatment,
Yeah.
but I like using it as an adjunct.
So I like to think of this kind of like in 2 categories. It's what is someone going to use on demand in the moment, and how is someone going to retrain their body so maybe they don't need to use an on-demand therapy,
Right.
okay? So for the on-demand therapies, my go-tos are going to be a delay spray, right? Easy to do, super discreet, works within a couple of minutes, great. Another on-demand therapy, these are new, and there are 2 companies now that have come out with this technology, are TENS units, transcutaneous electrical nerve stimulation. When I was at the University of Iowa, there was actually a researcher there who had incredible expertise in TENS units, which is where I was initially introduced to these ideas, and it's a great therapy for treating chronic pain. But it can also result in neuromodulation, right? And so there are 2 companies that have come out with small pads, electrode pads, that go in the perineum, the area between the back part of the scrotum and the rectum, and they help neuromodulate that ejaculatory
And
reflex.
it's a battery pack.
Battery pack, yeah. So one is just like, it's literally like a disposable patch. You put it on there, you press the on button, and then, you know, it works for like several minutes, and then just like the battery dies by itself. The other one has a rechargeable battery that you put on the patch.
So how many people would use it and find it so kind of noticeable that it interfered with their normal enjoyment of sex?
So that's where, you know, the person's going to have to discuss this with their partner. So it's not seen as like a weird thing, right?
Yeah.
One of the patches is black in color. The other one is white. So like for the most part, you're going to see them. They might come out with iterations that are different skin colors, right? So they're less
I don't think it's the
noticeable.
color that's going to bother
Yeah.
somebody. I think it's the actual, I don't know if you've ever used a TENS unit, but
Yeah.
you can feel them. I mean, it's not just, you know, depending on how, now is the current modulated? Can you like change the current?
So with one of them, you can.
Yeah.
With one of them, you can
That
change
I
the
would think
current.
would be
Yeah,
important.
through the
Because
smartphone.
sometimes everybody has different levels of sensitivity to TENS units.
Exactly. And so that's what they're trying to figure out with their technology is what are the best settings, you know, to treat these guys. Now, I did have a patient that recently tried the TENS unit because he wanted to last longer. And he said, yeah, it worked. Like he actually had to take it off to climax. It worked that well. So I'm excited about the TENS unit technologies because it's non-medication.
Right.
It can be used on
And it's
demand.
non-invasive.
Exactly. Now, the other therapies that can be helpful are like, how do we retrain someone, right? So we can retrain someone by sending them to see a pelvic physical therapist to learn how to control their ejaculatory reflex. We can help train someone by actually getting them a masturbation trainer, or the patient purchasing a masturbation trainer. They look like pocket pussies, right? And there's a company called MyHixel that has a great product. It's reusable. It looks like a vagina, feels like a vagina. But importantly, you can't just get a pocket pussy. You have to combine that.
I love the way she says, she just rolls off the word
Just rolls
pocket
off
pussy like it's, oh, we talk about it all the time. I mean, there are people out there who are not going to talk to their partner about pocket pussy.
I know.
I'm telling you, and this is Texas.
But they don't necessarily have to talk to their partners about it, because they're using this as a training tool. So they're not training on their partner, they're training with this tool so that when they're in bed with their partner, wherever they're at with their partner, they're good, right? But importantly, you use this
Can't
tool.
they think of another name?
That's okay. That company doesn't call it like a pocket.
Doesn't the word pussy fall into the same category as junk?
Maybe, or moist. Does that make it like, it makes me a little,
Wait. Pocket moist? I like the word moist.
No, yeah. Like the word moist makes me a little cringy.
That's so funny. Pocket pussy does not bother her. Moist bothers her. I mean, come on.
Only on fertility and other F words. So you use this technology in combination with cognitive behavioral therapy. So in my practice, I'm not a mental health specialist. I'm not going to train my person. I don't know how to train them in CBT, but it's a smart app that actually trains the person in the comfort of their home.
What is it called?
It's called MyHixel. So
My
MyHixel.
What's HIXEL?
That's just how you spell it.
But what is?
Yeah.
Oh, but it doesn't stand for anything.
Oh, yeah, I don't know. Yeah,
Pixel. I mean, it's not like.
Yeah, I don't know. We'll have to ask the company. But so that can help train the person to last longer, and they have research to support the use of that technology. There's another company called Tenga. They have actually a set of training units. One, so it's, again, resembles a vagina, and the opening goes from smaller to larger or larger to smaller, depending if someone wants to orgasm sooner or last longer. And I've had success, using that for some of my patients. Actually, a guy who wanted to orgasm sooner had success with
a
that
smaller
therapy.
one.
So if you're trying to orgasm sooner, you would go from smaller to larger. Like your goal is to be able to climax and have sensation in a larger orifice.
Yes.
Yeah.
But wait. So how about this? So the smaller or larger is someone who wants to climax faster.
Faster.
And
yes.
how about if they don't want to climax?
So if someone wants to last longer, they're going to go from the larger one, and as they're training their body to last longer, they'll be able to do that in a tighter orifice.
And this has been shown to be.
Yeah, Tenga actually has some research to support the use of their products as well in the PE space.
Yeah.
They're a company out of Japan. Yeah.
Interesting.
Yeah, very interesting.
So in terms of that,
Yeah.
what has been your experience? A little bit, we're taking a detour.
Let's take a detour.
What has been your experience with a couple in whom is the woman may have, through maybe several pregnancies, stretched out her vagina?
Yeah.
So it's not the small one, it's the bigger one.
Yeah.
Is that an issue?
So I think that is the elephant in the room, Larry. That
The vagina is the elephant?
Well, no, okay, let me clarify. I think the elephant in the room
I know, I was just kidding.
is that our bodies change as we go through different life events and get older. From the male perspective, the penis changes. The penis will oftentimes get smaller in length and girth as men get older, especially if they have erectile dysfunction.
Right, but I assume they don't have
Yeah.
erectile dysfunction. Is that a demonstrated phenomena that the penis does get smaller?
It's going to be from ED or like from prostate cancer surgery.
No, but just
Yeah.
aging.
Just from aging, does the penis get smaller if someone is getting regular erections?
Right. No, why?
No, I don't think so.
Okay.
Yeah. And
But the vagina
but the
with aging
vagina-
is going to get looser.
Well, the muscles are
muscles.
going to change,
Right.
right? And so what people don't really talk about is like, hey, can you still feel me? And can you still feel me?
Right.
Does that feel good as it did 5 years ago?
No one
like,
says
who's
that.
having that conversation?
They're not.
Right? And so actually,
So
yeah.
what do you do for the couple who comes in and the problem is the laxity of the vagina?
Yeah.
Surgery?
So I'm not treating
Rejuvenation
So I
surgery?
do see women, but I don't offer those therapies, and I'm not against them.
But is there tightening procedures?
Yeah,
You
there
should be
are.
doing them.
It
You
may
really
be something
should.
that I delve into, but I need to learn a lot more about it first because I
Yes.
want to make sure I'm doing the right thing
Yes.
and, obviously not doing any harm because it's a very polarizing topic. Now, for the male side, if their concern is I would like a bigger penis because I feel like both I would feel it more and my partner would feel it more. I mean, that's my space. That's like the most common procedure that I do, right? And
Which is filler.
Which is filler.
Right.
And so it was so interesting. I saw a patient earlier this week that he's like in his 60s. He's in great shape. He's been married to his wife for years. They have a wonderful relationship. She's had 5 kids. Doesn't feel the same, right? And so he gets filler, and he's so funny. He said, usually when I buy like a high ticket item, my wife is like, oh, you don't really need it. It's okay, we're good, And then he got filler, and she freaking loves the filler.
Oh, she can?
She
So it did
she
make
feels
a difference.
Oh yeah, she feels a difference. Yeah. And so he comes back to see me for like a touch up to get some more filler, and he said that he told his wife, hey, I'm going to schedule another appointment with Amy, get a little bit more filler.
She
and
said,
she said,
get extra?
she said, great, when's your appointment? So we both found that a little bit funny. But
It is.
the reality is our bodies change. If we don't feel our partners as much, there are safe options now that we can do something about it. So
See, I can see
Yeah.
the man
yeah.
saying, oh, sure, I'll do that. Why
Yeah.
not, right? And I'll say the woman say, there's nothing wrong with me.
Yeah. Look, it's a polarizing topic for both people. For men, penis size, what a polarizing topic. It's a very taboo topic. And the reality is, once we open up this discussion, that's the point of our
See,
podcast.
I don't see penile enlargement being taboo.
Yeah.
Because, you could think of it as making something good better.
Right.
But in a woman with a loose vagina, how often are they even told?
Yeah.
Because what is their gynecological? They're not going every year maybe like they used to.
Yeah.
I don't know what happens after
Look,
menopause.
I think we have to normalize that discussion just like we're working on normalizing that for men and not pathologizing it, but
Right.
just saying this is what happens to the body when we have children and when we get older.
But how many people are there out there like you
Yeah.
who are going to say that to their
Yeah.
patients? I don't think gynecologists are going to say it.
Yeah.
Do you?
Yeah, I don't know. More and more people are having this discussion. But I'll tell you, in especially the vaginal rejuvenation space, you get someone up on a podium at one of our society meetings, they're going to get some hate from the audience.
Yeah.
Like it takes like a person with a lot of confidence in what they're doing to get up on that stage.
But I think part
Yeah.
of it is because it's viewed as cosmetic surgery, not as functional surgery.
Mm-hmm. Right.
So if you can educate them that it's actually functional
both.
surgery.
It's both.
But the
Yeah.
cosmetic is
Yeah,
not
yeah.
going to make it functionally better.
Right. Yeah.
So I think that's a very interesting, kind of nuance.
Well, maybe we'll have to do a whole episode on that topic.
Yeah, we'll have to. Yeah, we'll get somebody in here who does it a lot and
Yeah.
let them talk.
Now, the last way that we can help men retrain their bodies to last longer is sex therapy, right? So, and there's a new therapy. I'm actually on the advisory board for Cadence Bio, and they're coming up with a short-acting SSRI. Now, I'll tell you, when I was initially meeting with this company, I was very transparent, and I said, I don't like SSRI medications, point blank, period, exclamation mark. And I was like, I don't know if you want me to be on your advisory board, And they said, we actually are very interested in you being on our advisory board. And so I decided to join because I figured if I'm going to learn anything about the potential mechanism by which SSRI medications cause issues, it's going to be if I'm working with a company that's working on a therapy. Now, what I like about their therapy, and they're still early stages of their clinical trials, is it's a very short-acting medication. That's what I like about it. So we'll have to see if there are any similar side effects as we see with some of the longer-acting.
Because you don't know the dose relationship between the Paxil long-term, not the SSRI,
Yeah.
long-term effect
Yeah.
and the dose. You have no idea.
Yeah. So it's interesting, I think, from just the discussion that we've had so far, 2 different, experts in the fields of sexual medicine.
But I'm
with
not an
2
expert like you are in this particular area. I treat it
Yeah.
but I don't go into the depth
Yeah.
that you do, which is very important that there are people like you who can do that.
Yeah. So I'm excited.
I don't have the time to do it.
Right, exactly. So I'm excited about this paper because I think I'm going to start implementing the breathing exercises.
Yeah.
And I'll keep you posted.
Why not?
Why not? It's
does-
breathing.
yes.
It's breathing exercises. You can't harm anyone
Right.
with that.
We just want you to breathe.
I just want you to breathe. All right. So trash or treasure with that article?
Oh,
Treasure, 2 thumbs
Treasure,
up. We
thumbs
love
up.
it. We
I
love
liked
it.
it.
Non-invasive therapy breathing.
and not only that, it's a little bit innovative. It's,
Yeah.
there's no downside.
Yeah.
It's the kind of thing I like.
Yeah. Welcome to today's episode. I am thrilled to introduce our remarkable guest today, Jeff Abraham.
So Jeff Abraham is the CEO of Promescent, a sexual wellness company devoted to developing science-backed solutions that help individuals and couples overcome intimacy challenges. After a long career leading a semiconductor company, which to me is amazing that he made this shift, he came out of retirement in 2012 to lead Promescent, building it into a fast-growing $12 million brand whose products are supported by over 2,000 urologists. Very impressive.
Jeff is passionate not only about product innovation, but about destigmatizing topics like premature ejaculation, helping people understand that intimacy issues are deeply human, not shameful. He's a leader who's learned from navigating tough regulatory terrain, manufacturing hurdles, and personal loss, and through it all has kept ethics, honesty, and customer impact front and center. We can't wait to hear from Jeff today. Hey, Jeff, thank you so much for joining us today on our webcast.
Pleasure's all mine.
It's good to have you here. And I know you came in from Las Vegas?
From Las Vegas,
Yeah.
Summerlin, Nevada, right outside of Las Vegas. Yes, flew in last night.
Awesome. So I want to tell the viewers and maybe share with Larry too how Jeff and I initially met. Yeah. This was at a meeting for the Sexual Medicine Society of North America a few years ago. And we were kind of just shooting the shit a little bit. And we were talking about sexual wellness products. And so my friend from medical school, I went to Baylor, and my friend from medical school got me a vibrator like many years ago. And I kind of played around with it for a little bit, and it was fine, but nothing crazy. And so we got to talking about sexual wellness products. And then you said, why don't I just like send you some products to try? And I remember coming home one day, I was living in Iowa at the time, and I got this huge cardboard box of different devices. And I started playing around with them, and instantly it completely changed my personal life. I realized in that moment how much sexual wellness products can really improve someone's sexual life. And I then took that into my clinic. And, at the time, this was probably like 5 years ago or so, I started talking to my patients in Iowa about sex toys. And I think a lot of people would think, Iowa people want to talk about sex toys? They couldn't get enough of it, And so you changed my life personally and professionally, Jeff. And now it's interesting because at a lot of our scientific meetings, people want me to talk about sex toys because I think more and more urologists are interested. So
She's got a reputation.
I've got a
Yes,
reputation
exactly.
for being the sex toy person. And somehow my parents are still so proud of me. And I don't get it.
I have a question.
Yeah.
So was the person who bought you the vibrator a male or female?
A male.
Interesting.
Yes. My best friend from
kinky, but
medical school.
interesting.
It's
Yeah.
interesting. One of the things that I find, and I've actually done some videos and put them on our website, there's a lot of males who are intimidated by vibrators, that they literally think if their partner needs a vibrator, that means it's less, they're less
Right,
of a
they're not
lover.
doing the right
They're not
thing.
doing the right thing. And what I try to tell all of our customers and people that I talk to all the time is you should be focused on your partner having as many and as intense as orgasms as possible. Check your ego at the door,
Yeah.
okay? If having a vibrator and you gives her more pleasure and more orgasms or more intense orgasms, then so be it. Because at the end of the day, the more pleasure your partner receives, the more likely she is to make sure you receive pleasure. Because most women, if a guy has reasonable personality, he's a decent provider, and he's providing many quality, intense orgasms, she's going to go, I'm making sure he's not going anywhere, okay? So you're really paying it forward. You're doing yourself a favor by making sure that she has as much pleasure as possible because she's going to make sure you do as well.
So, gentlemen,
good
listen up
point.
to this podcast.
Listen up to
gonna
this
be your
podcast. We're
doozy.
unlocking the vault.
So, as part of your company, and we're going to delve into the main part of your company, but you do sell sex toys.
Yeah,
what
we
are
do.
the popular ones people are picking up these days?
It's really interesting. Up until 3 years ago, the most popular ones were all female-centered. Then
For
we have,
instance.
For instance,
gonna guess the magic wand.
rabbits, magic wands, those types
People
of
who
things.
are watching don't know what you got to explain. What is
A
it?
rabbit is dual-headed, where it has two different, one more for penetration, one more for just clitoral stimulation. Believe it or not, they call it the little black dress of vibrators, the magic wand. The thing has been around 50 years, and no matter how many exotic vibrators come up, it looks like a microphone stand. It literally does. And they made a joke out of it because now they do podcasts for Magic Wand, and they have the magic wand fashioned into a microphone. And it's just a big bulbous head with a giant stem on it, and it just vibrates. Sometimes complex is not better. Sometimes, and almost every woman that I've ever met who uses vibrators has a magic wand.
Do they thank you?
They generally do.
Well, okay,
Yeah.
I will tell you that the magic wand, as you alluded to, is like the OG.
It's the OG.
Original gangster.
It was the original one. It was
Yeah.
the first one.
And I think one of the nice things about it is it does not replace a penis. It can be used in combination with a penis. And when I show people the anatomy of the vulva and the entire clitoral complex, they understand within 3 seconds the power of the magic wand.
Absolutely.
Because it can vibrate the entire clitoral complex without having to be so precise.
Yes.
So do you now have the rights to this?
Well, we make our own, but we still sell the magic wand because that thing is patented every which way that you can't possibly,
So you
make
don't
it.
own that. You just
we don't
sell
own
it.
that. We sell that. Almost every other one we sell, we make ourselves.
Okay.
But I know he happens to be a very good friend of mine, the guy who is the CEO of it's called Vibratex, who makes magic wand. And so we were doing research because I was dating a gal who had 50 vibrators. I swear to God, she had 50, 50.
Not me, not me,
No,
it's not me.
wasn't her. Yeah, I'm way too old for her. Yeah. So I was dating someone, and I'll never forget this. And she was introducing all these toys into the relationship. And I'm, oh, that's cool. What's that? She brings this. I go, what is that? She goes, this is a little black dress of vibrators. I go, what? I go, that thing looks prehistoric. She goes, it's been around 50 years. And she goes, this is my third one. I've been using this for 20 years.
She wore them out.
Yeah. She literally wore them out. But she goes, no
Maybe
matter.
we all wear out our magic wand.
That's exactly. She was on her third one. Think about that. She goes, no matter how many other new vibrators come out, I will always have a magic wand. So I said, we got to have that, because so many people find it, So I was doing a search, and this guy, Ken Hershkowitz, used to be with Emily Moore, Sex with Emily. He was her PR guy. And I do a search, and I go, I wonder who runs this company. I go, that's my boy, Ken. He had just taken a new job. So I called him, and so we started, carrying it, and we do really well with it.
So interesting.
Yeah. But you said some of the newer products people are getting are not necessarily female focused.
No, this is the crazy part. The rage now in sex toys are male masturbatory products. There's one called the octopus, the hot octopus.
Okay, come on, you got to tell us what these are. You can't just say the octopus.
There's the fleshlight. The fleshlight is literally like a flashlight with silk and all kind of products inside to stimulate and basically mimic a vagina.
Okay.
And there's some that are as cheap as $25 or some as much as $600, depending upon the level of sophistication.
So what does the 600 have that the cheapest one doesn't
It
have?
warms and it vibrates, and the cheap one...
Does it talk?
No, it doesn't talk. It doesn't moan to give your ego a little satisfaction. You know what I
So
mean?
you
could
might
do
not
that.
want it to talk, but you might want it to
No,
moan.
but you could do that.
You could. Absolutely, you could.
I like that.
Yeah, that might be the next option.
Larry, this could be your your product.
Exactly.
portfolio.
I'm there for you.
Therefore, we can develop something. But it's strange how, for the longest time, men weren't comfortable, because a lot of men were very uncomfortable actually saying that they masturbated. It was like, well, I'll do it, but in private, I'm not proud of it. It's no longer that way. Guys come on and they buy a ton of masturbatory products.
You know what I think?
do
They
you
buy
think?
them online, right?
Majority of them are
Yes,
online.
because you don't have to go and face somebody and buy it.
Yeah.
You just click and you get it. And I bet that made a big difference.
It made a big difference. I will tell you that this is funny, because I tell people, even with our products, that I'll go into stores, because we're everywhere now. So I always want to see, hey, how are we positioned? How's the set look? And I walk in.
You don't have them like inside and go like
Maybe that's my next thing. Just open up. Hey, there's other things that aren't in here yet. Let me show you what we have. But I've gone into Target. I've gone into Walmart. I've gone into CVS and H-E-B, these places. And I swear to you, go in any other department, whether it's shampoo, toothpaste, people walk right up. They're looking at the product. And with sexual wellness, they stand about 5 feet back and they look. And then they go up and they get a closer look and they look on their phone. I call it the snatch and grab. Then they walk up, they grab it, and then they go right to the checkout. No one wants to be standing there holding up 2 different male masturbatory devices or male delay spray or female arousal gel. I call it the snatch and grab. They stand back, they evaluate. And then as soon as they go, okay, no one's identifying it as me, they reach out, grab it, and go right to the checkout and on the way out.
But it is nice that they're having a lot of those sexual wellness aisles now that make it more convenient for people to go in, where you don't have to go into a seedy adult store.
Right.
Yeah.
Like the Target aisle is a beautiful aisle for sexual wellness.
And it's really well positioned and marketed. Let me tell you how we've progressed. In 2012, when I first became involved with Promescent, I took Ron, who was our founder, into Target. It's the one on Brookhurst and Adams in Huntington Beach. There was one product, and it wasn't even promoted as sexual. It was KY.
Yeah.
That was the only product. It was more like medicinal. And he said,
it is. I mean, so.
It is. KY is, yeah. And he said, you think we'll ever be in there? I go, I guarantee you, this space is going to explode. You walk down that same aisle right now. I wish I was kidding, but I'm not. I swear to God, there's 47 different vibrators. There's every lotion, every gel. They have butt plugs. They have prostate massagers. I'm like, think about in 12 years, we went from where there was one product that was a medicinal KY jelly till now where you can buy butt plugs and vibrators and prostate massagers, for God's sakes, in Walmart and Target. That's how much we've progressed.
Yeah. I'll tell you what, if I, God forbid, pass away
Yeah.
and someone goes through all my stuff and they open up my drawer and they find all of my products, they're going to know I lived a good life. That was a life well lived.
Lovely,
you know? So now I'm not
lovely.
embarrassed by that anymore.
No.
Yeah.
Years ago, you probably would have said, in case of my demise,
Yeah.
send someone in and there's a little brown pouch in
Throw
there.
it away.
Burn it. Put it. Don't even open it. Just put it in there and burn it. Unlike you, unfortunately, my son has to experience this because my son will go, oh my God, Dad, someone sent me that podcast I heard you on. I don't need to hear my dad waxing poetic about sex. You're my father. I go, you don't see me sending it to you. That's your friends and my friends sending it to you. Tell them to stop doing it.
So you mentioned Ron.
Yes.
And so I want to delve into Ron a little bit and his legacy, because this is how you were a semiconductor, in that business.
Yes.
And now you're in the sexual wellness business. Can
Correct.
you share with our viewers the story of Ron and his legacy?
Yeah, I call it the most circuitous route ever to being the CEO of a sexual wellness company. So I owned a semiconductor engineering business, and I started it the year my son was born in 1988. I was working for someone else in the semi industry and then started my own semiconductor engineering recruiting business. So Ron was my urologist, my friend, one of my neighbors. So we were really tight. And so I raised my son as a single father. He left and went to school, and I went to see Ron later that year. And he goes, hey, I need your advice. Because he knew my story. I grew up, relatively poor, and I moved to California and had a lot of success. I just worked hard. And he goes, I developed this product. And he goes, I need your help. You can help me market it. And I go, what is it? He goes, I developed a solution for PE. I go, you developed a solution for physical education? Because when I was in school, PE was phys ed. He's like, no, dumbass, it's premature ejaculation. I go, oh, like ED is erectile dysfunction. He goes, yeah, that's when you're in the business. I go, oh. And I go, is that like a big market? And the funny part was, literally 2 weeks before, I'd seen a special on 60 Minutes about ED drugs. And they estimated that the market for ED drugs was $5 billion. And they said for every legitimate one made, there were 2 knockoffs made in China and Mexico. I'm like, okay, so that means the total market's like 10 billion. So I said, how big is PE compared to ED? And I thought he was going to say about 10%. He goes, it's actually a little bit larger. I'm like, excuse me? He goes, larger. I go, that's insane. He goes, actually, some of ED is misdiagnosed PE, because he goes, if a man has chronic PE and can't get over it, eventually it's like stage fright. He's going to develop, ED, because he knows getting an erection leads to an unsatisfactory conclusion. I go, you mean this market is potentially billions of dollars? He goes, yeah. And he goes, what do you think? I go, I'd love to help you out, but is this like prescription? He goes, no, it's OTC. I'll give you a sample. I said, okay, great. So he gives me a sample. Now, being a little bit adventuresome, I don't even get out of the parking lot, right? I call the gal that I'm dating. Her name was Carolyn. She was an investment banker.
Carolyn.
I go, Carolyn,
You're listening.
Would you like
Hi.
to come over this evening and have dinner? I go, I want you to help me, with an investment I'm thinking about.
Testing a product.
Yeah. Well, she worked for Shearson Lehman. She was an investment banker. So she thought it was like I was going to have a spreadsheet,
Right.
Whatever. So we have dinner, right? We have dinner. We get done with dinner. And she goes, oh, let's take a look at that investment. I go, okay, great. So I go upstairs. I come down with
So
this
you
bottle
pulled
of
your pants
Promescent.
down.
I come down with a bottle of Promescent, and I go, here's the investment. She looks at it, and she goes, you're such a pervert. And I go, actually, you're right, I am. But this is the actual investment. I'm not joking. She goes, what? And I go, look, that's Ron's company. She knew Ron. Mm-hmm. She goes, oh, my God, it is. I go, yeah. I go, he developed this product, and, I want to test it out. So I read the instructions. It says 3 to 10 sprays. I'm like, okay, I'll start with 5. I didn't realize that if you have PE, but it also has recreational use. So we start, our little session. We're intimate. 45 minutes later, I'm sweating. She's dying. She's like, get off me. I'm like, I put all this work in. I'm finishing, okay? So the next day, I call him. You're going to laugh. He's like, what do you think? I said, before we go any further, we need to change the name of the product. And he goes into this impassioned defense. Well, Promescent means prolonged tumescence. He goes, wait, what do you mean? What do you want to change it to? I go, how about bone like a porn star? He's like, what? I go, that stuff's insane. I go, I literally could not finish. I go, I was like, he's like, how much did you use? I go, 5 sprays. He goes, well, that's if you have like PE. I go, well, why didn't you tell me that before I tried? I go, it said 3 to 10, so I decided 5. It was on the lower side. And he goes, no, you have to dose it. Start with 1, and because it's a meter dose spray, so you get the same amount. I go, oh, and I go, hey, I want to invest in the company. Because right then I went, oh my God. I was like, because I will tell you this, any man who will say at some point in his life, especially sometimes when you're younger, you're just getting started on your sexual journey, will tell you there's never been a time where at least once or twice in his life, you're acutely aware of you're getting near that point of no return, inevitability, and your partner's not finished yet. And there's that little guy on one shoulder going, oh, this is going to feel so good. You want to finish? And there's a little guy on the other shoulder going, not yet, you idiot. She's not done yet. We want to have something, mutual here. So I want to tell you that one of the best things that he discovered, and he made this really clear to me, this isn't for just people with PE, because there's a lot of people that can enhance their intimacy, even if they don't have PE, because their partner takes a lot longer than they do. And so it was very apparent to me there was a big market. So I invested in the company, and immediately we started doing stuff together. And he had a friend of his from high school and college that was running the company, but they were mimicking all these other lidocaine-based spray for PE that were garbage, that didn't really work. And I kept telling him, you need to start pivoting towards the medical community. And I go, you're a urologist. Why aren't you getting medical? We need to do a clinical trial. And he's like, well, the other guy's running it. And I go, you need to take control here. Long story short, I invested some other money in another additional $500K because I wanted them to do some trials and patent things. And I said, if you do it, you have to put it in a specific escrow account and do exactly what I'm telling you, because you guys are not on the right track. And when they realized that I kind of had a flair and a feel for this, they asked me to take over the company. And I did. And so that was the genesis of where we really moved the company into the medical arena. Because I go, why would you have a superior product and market it like all the products that people had tried before that were unsuccessful?
Were there a lot?
There were tons. I wish I was kidding when I said this, but back in 2012, we did a study and we found that there was 170 products to treat PE.
Wow.
160.
Are we talking about products to decrease sensitivity or just, what kind of product?
Everything you can imagine.
But how about to decrease sensitivity?
There was probably about 10 to 12.
There were
Stud
that
100.
many.
Oh, yeah. 10. There was Dynamo Delay, Shibaru, that all these companies, they all were the OG in this space. We talked about the Magic Wand being the OG. In this space is Stud 100. It is basically a lidocaine-based spray. The thing that makes Promescent unique is we have a eutectic formula. So with the eutectic formula, lidocaine in its native state is like a crystal of salt. It's a solid. So when you apply it, it sits on the surface of your skin. It does numb you, so you're desensitized, but it also transfers to your partner, no matter what type of sex you're having, no matter who you're having it with. So everyone's numb. I tell people, you might as well go take a spin class or take a hot yoga class. Everybody's moving, everybody's thrusting, but no one's climaxing. You're defeating the purpose, okay? Everyone's too numb to enjoy it. So what Ron did was he got together with an inorganic PhD chemist, and they changed the crystalline structure of lidocaine with the eutectic formula. So it's changed to a solid. So the lidocaine is no longer a crystal or a salt. It becomes oil aqueous. So when you apply it to the skin, it goes through the dermis, the stratum corneum, to the fatty tissue underneath. So the man maintains a much higher degree of surface sensitivity, and it doesn't transfer to the partner.
Do you have to wipe it off, or you don't? It just gets absorbed?
The only time you would wipe it off, it gets absorbed, but there's some of the non-active ingredients that might be there. So if you're going to have oral sex performed on you, you can actually, it has almost like a medicinal taste, kind of like a Listerine thing. So you would want to take a damp cloth and just wipe it off. But you want to wait 5 to 7 minutes because that's how long it takes to absorb. But if you're not going to have any oral sex, there's no need to even wipe it off.
So I think that's really fascinating. I love getting into the science behind the innovation. And so that's what I'm hearing is making your product different from so many of the others on the market. Because we hear all the time when people use delay sprays, like when they say, oh, I used a delay spray, it didn't work, or it numbed my partner, I always ask, which one did you use? Because the technologies and the products vary.
It's like saying,
I've heard complaints that the partner says she got numb.
Yes. Here's the crazy thing. This is mind-numbing, okay? So I tell you about all these different products that are out there. And Reckitt Benckiser has one, and Trojan. These are big billion-dollar companies that have one. Now, this will blow your mind, okay? So we're the patented technology. We are the newer product. Reckitt Benckiser is Stud 100. If you look at the two labels, it's not close. It is exactly Stud. They took a 45-year-old product, okay, and literally said, because of our marketing muscle, because we own, they're $24 billion a year. They own 70 brands.
Wow.
They go, we have so much power, we're going to basically just shove this down people's throat. We're going to be so, and they got a lot of business early on. Everyone tried it, and everyone's like, this doesn't work. It numbs me, it numbs my partner. Trojans is another 30-year-old product. It's CC Wellness Joe. So it's CC Wellness Joe, Trojan, Cake. They're all the exact same product. So you have these big companies that feel like they have so much marketing muscle and they have so much cross-pollination, on their other condoms, on their other lubes, they'll just promote the product. But they take a 30 to 40-year-old product and keep trying to reinvent it. It's already failed. People have already tried it. And I've had people say, I had the same experience with Duration that I had with Stud 100 that I had. I go, because it's the same product. And I show them the labels.
Yeah.
And they're like, what? It was funny because when we first started to have success at retail, we had buyers going, why is this selling and the other ones aren't selling? And one particular buyer came to us and said, our repeat business, because they have all that data, because people use those frequent buyer cards, and they go, your repeat business is 5x anyone else in the space. And I go, look at the label. And I actually showed her, I go, these two products you have that you're marketing from two different companies, it's the exact same product. She's a buyer for a major retail company. She had no idea. I go, don't you do research in it? She goes, no. She goes, it's the exact same product. I go, you have two products side by side. They're identical. They just have different labels on them. I go, let me show you. Here's what's different. And I explained to you. She goes, no wonder you're having this kind of success. I go, that's because we're better. And so for us, our growth has been exponential. Up until 2 years ago, we had 2,500 retail locations. We were in 1,000 Walmarts on a test.
Wow.
We were in 1,500 Targets, full distribution. Then Walmart looked at the numbers and made us in all 4,000. So we went from 2,500 2 years ago to 5,500 because we got all 4,000 Walmarts. We're now in 14,000. Okay.
Oh, wow.
We got in CVS, we got in HEB with 2 products, we got in Meijer with 2 products, we got in Wegmans, which is kind of a Whole Foods kind of chain along the Atlantic seaboard.
Yeah, I was telling you earlier today,
Right.
we were talking about New Jersey, and I said the best part about New Jersey is Wegmans, and he
Right.
looked at me like I had 4 eyes. I'm like,
I
you've
love
never
Wegmans.
heard of
They put
Wegmans?
3 of our products in there. Go to Wegmans if you live in that area. I love Wegmans. Yeah. They're the first one that actually launched with 3 products.
So it's in a grocery store.
It's in a grocery store.
So what are the 3? There's Promescent.
There's Promescent Delay Spray, there's Promescent Delay Wipes, and there's Buzzing Female Arousal Gel.
So what is that?
It's basically...
And it's called buzzing.
We have warming and buzzing. Women are a lot different than men. A lot of
really?
women love, as any guy who's dated, multiple females will tell you, there's not one technique. There's not one thing. Most guys, it's like they love the same things. I've never met a guy ever in my entire life who goes, I don't like oral sex. You know what I mean? Never. The first one I meet will be, the next one will be the first. But every guy's been through the situation where you date someone and they're like, whatever you do, don't touch me directly on the clitoris. I'm very sensitive in the area, just lightly around this area. Then you date someone else like a year later, they're like, get some sandpaper, you know what I mean? It's like, whoa, how can you be the same gender? How can this be the same species, Women are different. And there are some women that love this warming sensation. It's kind of a licorice thing, and it just warms the area and blood flow. The other one has more of a pepper formula, and it's more jolt. And certain women love buzzing because it's more of a jolt, and certain women like the warming because it's much more subtle.
Okay, Amy, so why are women so different? No, I'm sure this is something you have to deal with.
Why are women so different?
Is it anatomical?
Okay.
Is it
Here's
mental?
what I think. Here's what I think, though. I think that we think women are so complicated. In fact, that's why for many years I didn't treat women. It's why I treated men, because I was like, okay, I can help guys. I have all these tools in my toolbox. Guys are pretty simple. I think women are just go down a rabbit hole. I don't know if I can help them. And what I've realized over the years is men are as simple or as complex as we allow them to be.
Absolutely.
And we oftentimes put them under this heading of erectile dysfunction or sexual dysfunction. And then when we ask about orgasm and ejaculatory function and sensation and premature ejaculation delayed, and we don't put them in a pretty little box, men are actually very complex. So I think you see complexity in both areas. I think some women are very simple, and I think others are very complex. So I don't know if there is a difference. I would say there's more differences amongst women and amongst men than between men and women, now that I'm seeing men and women.
Yeah, that's what I'm...
One thing that you'll find fascinating, the first 8 years when all we had was men's products, we have a little thing called Zig Poll. About 8% of people fill it out. And one of the things is, how'd you find us? And you go down podcast or, advertising, blah, blah, blah. And the last one is referred by a friend. Mm-hmm. We didn't have a single person ever in 8 years that went referred by a friend. As soon as we start selling female products, it's insane. 75% of our female products that are sold to women, how'd you find? Referred by a friend, referred by a friend. And it really hit me. If a guy finds out that something makes him better in bed, the first thing he does is go, I don't want anyone else to have this. Every man has this desire to be the biggest, strongest, most colorful rooster in the hen house, and he wants to go impregnate every single hen. Okay, that's mine. I have the secret. If you give a woman something that gives her more frequent or more intense orgasms, she's on Reddit, she's on Pinterest, she is texting, she's emailing, they're playing bunco, they're having lunch, go, oh my God, my orgasms
But you see,
are
I don't
so-"
think there's that much difference. I think the guys don't refer to a friend because they don't want to admit they had a problem.
Well, that's absolutely.
Whereas
that's probably
women,
part of
women
it.
are very, they talk.
They talk, absolutely.
And they confide in each other. Guys do not confide in each other.
I think guys are more likely to brag about their sexual prowess
Exactly.
rather than saying,
I got something to help me.
I have something to help me. Because I've run into this, and we used to have this saying, and I said, if every time that I heard this, we had $1, we'd have $100, and I had to change it to 1,000. Now I'm up to 10,000, okay? I'll be somewhere and there's a couple. And they go, what do you do for a living? I go, well, I'm the CEO of this company. What is it? I go, it's called Absorption Pharmaceuticals. What's your product? Promescent. What's it for? And as soon as I say that, the guy will go, it's the last thing we need in this relationship. Oh, excuse me. Right. And then later on, this actually happened at a party in my neighborhood. The wife comes up and goes, we could use that. Like, do you have a sample of that? Right. It happens so often. It's crazy.
Which goes back to what I said.
Yeah. Exactly what you said.
Don't admit it.
Guys won't admit it.
But what's so fascinating is I don't think we've ever given the stage for men to speak about their concerns. Because once you allow a person to open up, these guys don't stop talking.
But is this to you or to each other? I think guys will talk to doctors.
They will talk to doctors.
Because
Exactly.
they've made the commitment to go to the office.
Yeah.
Once they're there, they don't keep secrets.
Yes.
But I think amongst each other, there's kind of this herd mentality. They want to be head of the herd.
Yeah.
Yes.
You know.
But I had a patient recently who opened up to one of his friends. I do penile enlargement for him, And so like most guys are not going to talk about their friends about that. And he started talking to one of his buddies about it. And now it's just like something that they discuss. And he's like, yeah, you should see Pearlman, whatever. I have another guy that he used to never talk about sexual health stuff. And he had one of his friends talk to him about shockwave therapy for ED. And now every time they meet up with each other, they're comparing notes about different treatments they're trying. So I feel like when men have the experience of that camaraderie of sharing with other men, they realize, wow, this is really special.
I don't know.
It's just getting that first step. I think it's a scary first step. But you probably talk about this with your guy friends, right?
I do, because of what I do for a living. I have guy friends that literally look at me like a doctor now. They call me up and go, hey, I'm having this erectile. I'm like, whoa. But of course, we have discussions. And a lot of times I'll refer them to someone, because I know a doctor in almost every city now. Right. So I'll say, listen, I'm not really qualified to give medical advice. I can help you out and point you in certain directions. But I think, just like Larry said, that they look at me is almost like a doctor, someone with information. Mm-hmm. So I'm hoping that what you're saying is correct, that they're comfortable in just a recreational setting, sharing something, go, hey, I wasn't really that good. Now I'm better. I found this. But I do know guys will speak to a doctor, or they'll come to me because they'll go, this guy might have the keys to help me unlock something. Mm-hmm. But one of the biggest stigmas that really I see starting to come down now, and this really frustrated me when I first got into this business, is there was this theory that a lot of people had, comedians and all these memes and jokes about guys that had PE just didn't want to satisfy their partner. They were unconcerned about their partner's pleasure, or they didn't have the mental strength to hold on long enough. You guys are obviously aware of this. There's a lot of physical reasons why you can have PE, not limited to, but certainly prostatitis and, low T and all these different things. There are certain types of PE that are psychologically, related, but don't throw everyone into that basket and think that you're weak mentally or you don't care about your partner. I'm sure you've seen this in your practice. I know just from talking to a lot of our customers and a lot of people that I deal with, there's nothing further from the truth. Guys who have PE, guys who have ED want nothing more than to satisfy their partner. They desperately want to satisfy their partner. But
it's a little different now, because with ED, you're not performing.
Yes.
With rapid ejaculation, you are, but you're not satisfied.
You're not satisfied.
So there's
Big difference.
There's more selflessness in being concerned about PE than there is about ED.
Correct.
Don't you think? No, she doesn't. She doesn't agree. I can tell that look. It was not a nod. It was a...
I think the big problem is when a couple doesn't communicate these concerns. Because even for someone like me, who has a lot of knowledge and clinical expertise in this space, if I am with a partner and he climaxes, pretty quickly, and then doesn't have any sense of how I can pleasure her, even after that happens, I take that as that guy doesn't care at all about my pleasure. But it's that lack of communication.
Oh,
right?
Absolutely.
Because it's rare that person is going to admit to his partner, hey, I really want to last longer. It's just for whatever reason, I can't. I just
what do
don't.
You say in those situations? Do you tell them?
Oh, God, it's challenging.
You opened it up.
I'm really curious. You opened the door. We're coming through it now.
I would not have asked, right? She was the one who's opened it up.
I will tell you, in that scenario, and one of my partners I have in mind for this, despite the fact that I would tell my patients they need to learn how to communicate, I really wasn't sure what to do. But I just felt really sad after we had sex every single time. And so I remember telling him, we were on a trip and we were in a hotel, and I said to him afterwards, I feel really sad after we have sex. I know everyone listening, if you're like a sex therapist listening, you're like, oh my God, I must see her as a patient.
You better not left it there. You better explain why.
We're waiting. We're hanging on every
and he
word
said,
here.
why? And again, this is... Okay, folks listening, I do not recommend you verbalizing what I'm about to verbalize.
Oh, here it comes.
Yeah, here it comes. We're getting to the meat. We're getting to the juicy part.
I said, how would you feel if you only orgasmed 1 in 10 times you had sex? But he had the audacity to say it's not all about sex. And that blew my mind.
I don't even know. Did you say, what does that mean?
Right, because for me, it's no, literally, it is all about sex.
The whole reason you're having it is for pleasure. I mean, if you're going to do it.
Well, it depends what it is. So, when he said it's not all about sex, I mean, you're having sex. So,
exactly.
And the conversation is about sex. But it sounds like maybe he was just talking about a relationship, a loving relationship, and maybe he was very deep.
Yeah.
No?
Larry, I don't think that was the case, but I could be wrong.
Is that the last time you saw him?
No. But we did not have an open communication about our wants and needs. And I think that was the detriment. That was really a big issue in our relationship that we never really spoke about.
But let me ask you a question. Doing what you do for a living, did you ever say, hey, this is my area of specialization. I think I can help here so that we can both reach.
She never
Look,
said
I will
it.
tell you, Jeff, that dating me is a blessing and a curse.
Oh, you'd be very intimidating, okay? It'd be like,
It is.
get in here and dance for me, monkey boy. Get those pants off. You know what I mean? It'd be like, whoa, whoa, whoa.
Okay, for the record, I have never said, get in here and dance for me, monkey.
I'm joking, okay? But
Oh, I like that line.
yeah, a lot of guys like to think that they're, really the best lover in the world. You know what I mean? That they have all this knowledge,
Right.
That's changing, but that still is something that a lot of guys at least want to have that fantasy. You know what I
Yeah.
mean? So if someone's dating you or another sex therapist or, someone who's really learned, it's a little bit intimidating,
Yeah. It takes a guy who has an open mind and who's just as curious as I am.
Curious, but also confident.
And confident.
Absolutely.
Yeah. Now, what I did learn something from a sex therapist because I have tried to bring out the magic wand before with a partner as a first toy that I brought out, which I've learned is not the best toy to bring out the first time you're bringing out a toy because it's so big. That's
exactly what I was going to
Yes.
say. It's shaped like a penis and it's gigantic.
Yes.
You might want to bring out something that's a little less intimidating
Wait a
than
second. I want to
magic
ask you
wand.
something.
Like a magic- like a-
After how many dates would you even go there?
Yeah, sometimes not that many.
Oh, that's intimidating.
So I think,
Yeah.
yes, I think like a bullet vibrator, which I know Promescent has, but like a very small one that looks like a lipstick.
That's exactly.
Where no guy is going to say, how am I going to compete with that,
Yeah.
right? But I think it's also, I will say some of my better sexual experiences are with men who have used these products before, who just normalize it. Because when they normalize it, I can then be in my most authentic self when I'm
Yes.
engaging in intimacy. And when I feel that I can be authentic and actually enjoy the experience, I will climax. And
Yes.
it will be significantly better. But it requires my partner to accept the fact that I want clitoral and vaginal stimulation. I want it
Yes.
all. I want it all,
You
Jeff.
want it all? Who wouldn't?
Yeah.
If you
when
can
was the
take
last
it-
time you had a conversation like this with a doctor?
Probably
huh?
like a week ago with a doctor. With a doctor.
No, with a doctor.
With a doctor, yeah, because doctors are really curious and they'll hear me, either on a podcast or a serious show, and they will call up and they will go, hey, I want to incorporate some of your products into our practice. How do I do that? And so we'll get in conversations. But generally, it's not this involved,
Yeah.
and certainly not about their own personal sex
Exactly.
life.
That was
it's
my
more like
point.
they always frame it, my patients.
Yeah.
You know what I
No,
mean?
this
My
is
patients'
this is
experiences.
unique.
This is unique.
And sometimes I do share some of these instances with my patients because the reality is I'm asking my patients to come in and sometimes verbalize things they've never verbalized before. Like within, 5 minutes in a sexual medicine practice, we're like, how do you like to have sex? How often, how long do you last? Like all these pretty invasive questions that I think sometimes coming at it from like, hey, we're all part of like this same shared experience. And I'm such a firm believer that if we have the tools in our toolbox as we get older, we can have the most amazing sex we've ever had. We just don't know it yet.
Yes.
And that's what I try to emphasize to my patients.
Well, I'm 68 years old, and I can tell you this, that I have no ego. It's like whatever I need to do
Yeah.
to get my partner to climax as often and as intensely as possible, I'm totally open. And I have every...
You hear that, ladies?
Yeah, I have every vibrator ever made in my home.
Are
Because
you going to give out your name and number here?
I
Is this
would
an
if-
advertisement
I would if
for
this
you?
wasn't a video and they saw my face. I go, oh, that guy might be hot. You know what I mean? But it's pretty much already done. They can see me, They'll go, sorry, Grandpa, But it's one of these things that I'm really glad we're getting the chance to talk about this because hopefully people listening to it will have less apprehension. And especially men who will go, whoa, I always thought this is because I'm not a great lover, not in addition to me.
I think that's a good point.
Yeah. And what I love about a lot of the therapies now that are for premature ejaculation, and now there's a lot of ones that are coming out. I know there's like an oral medication, like a short-acting SSRI that's, I'm on their advisory board, so that's kind of in the works. And then there's now like transcutaneous electrical nerve stimulation, like a TENS patch that you put on the perineum. We have delay sprays. We have masturbation trainers. So when I talk to patients now, I used to hate talking to patients coming in with premature ejaculation.
Well, you didn't have a lot to offer.
Because you didn't
Yeah.
have a lot to offer.
Right.
And now, sometimes it's overwhelming with all the different therapies. And what I've learned is the guys who wants to use a TENS patch, it's probably a different guy than someone who wants to use
Have
a
you ever
delay
seen
spray.
the TENS patch?
I have, yeah.
The guy came to me early on. Hey, you're really on we're going to remember what you've done. I said, I want to try everything. He
I
gave
haven't
to me.
seen it. Tell me
Yeah.
what's the
It's
problem?
literally a battery pack with a little wire and a TENS patch that goes on your perineum. Personally, I tried it because I
Yeah.
try everything.
Yeah.
I just felt like the $6 million man or something. You know what I mean? It's like you
Did
have...
it work?
No, it didn't really work
Well,
that
it's not
well.
going to work the first time. It
Yeah.
takes a few tries to use it,
Yeah.
but it has a battery on it. One
Are you
has a
supposed
battery.
to try it with somebody?
So you can try it with someone or alone.
Alone.
I always recommend people try it alone
Yeah,
first.
but
To
think
get
that
a
would-
good handle
the
on it.
settings.
Yeah,
You know what I
I
mean?
think
To see
that
if
would
it
be
works.
really...
Yeah.
awkward.
But the thing is, guys who
Excuse
want
me,
to use...
I've got to plug myself in.
Yeah, it's just so unnatural to me to have this device. You know what I mean? And it's just kind of awkward.
Yeah.
And it just wasn't. There's other things out there that I've tried and I liked.
Like what?
That one.
Let's give us your list.
There was a thing called Dupoxetine, which was
I remember.
yeah, it was in Europe. It was never really.
We never have it.
We never had it. It never got approved here. It was an SSRI that was daily, like on demand. And it
wait. Daily is.
I should say daily, on demand.
Yeah, it was on demand.
The day you were having
Right.
it, you take it a certain time before. And it had a little bit of an effect.
Yeah.
I tried Tramadol because you're the one who first told me about it. It had a little bit of an effect.
Yeah, it's not for people with serious problems.
I was just going to say that. That's
But
more recreational.
Well,
That's if you're lasting 3 to 5 minutes, you want to last 10 minutes.
Yeah.
I think if you have portal PE or you have serious PE, you're ejaculating in 30 seconds, I'm not sure it'll make that much
No,
of a
but
difference.
Tramadol is good because it's so easy to use.
It's a pain medication.
And not only
Yeah.
that, it's on demand.
Yes.
Because we don't have SSRIs that are not. Ours you have to get a really good effect daily, don't you?
I don't like SSRI medications.
Yeah.
I
I'll be honest
don't
with
like
you.
it because of the potential side effects.
So when Ron and I first got together and I was starting the company, I said, I really want to know before I put my second, I invested $100,000 the first time, I invested $500,000 the second time. I said, before I give you the $500,000, I got to try everything. I got to make sure I really know what it works. So I said, these SSRIs people are talking about, I want to try that. And I said, put me on, he goes, it's a low dose SSRI. And I think it was Paxil that he tried.
Yeah, that's the most common.
Yeah.
The low dose Paxil. So I've always had an extremely high libido from the time I was young. And so he puts me on this stuff. And like the second or third day I'm on it, I'm with my girlfriend. I'm like, oh my God. I go, I can't ejaculate. I was literally like 40 minutes in. I didn't even feel that beginning of the inevitability. Right. And she loved it. And I was like,
but you didn't have a problem to begin with.
I didn't have a problem to begin with.
But that's the problem testing these things when you don't have a problem.
When you don't have a problem because you're going, wait a second, even the low dose was too
Right,
much. But I'll
right.
tell you what scared the shit out of me. Like a week in, I started getting dry mouth and a little bit of nausea. And then I completely lost my libido. The first time in my life, I swear to God. And then I had this like brain fog. And my libido felt like someone put it in a garment bag and threw it in the back of the closet. And I called Ron. I go, I'm getting off of these right away. He goes, no, you can't. You have to ease off them. I go, what if this is permanent? He goes, I promise you it's not permanent. You know what I mean?
But the problem is, in some people, it's long lasting.
Oh my God.
And that's my biggest concern, something called post-SSRI sexual dysfunction. And those are the most complex patients I treat, hands
Oh my God,
down.
I would have freaked.
If you just wait, does it come back or no?
People have had this concern for decades.
That
Not
took
the
2
concern,
weeks.
I'm talking about the actual.
Oh, no, there are some patients that are like, I took this medication decades ago.
Oh, wow.
And I'm still suffering. And it's like, we think about in medicine, we're taught in medical school, all the side effects of these medications, right? So you start someone on a medication, they have side effects, you take them off. You would assume that all the side effects will go
Right.
away.
They don't.
But what if they don't?
Yeah.
And why is that such a foreign concept? Why would that be a foreign concept that some of these very powerful medications we put people
They
on
might alter something.
cause
Yeah.
and cause things that are irreversible?
Well, we would know. I mean, it's like the finasteride thing.
Yeah, but
Yes.
it's a similar phenomenon with
It is.
finasteride,
It
with
is.
Accutane, with SSRI medications. So I tell my patients, look, if there was a medication I could put you on and you have side effects for which I have no cure, you need to know that ahead of time.
Oh,
and that's
absolutely.
like a true informed consent discussion.
Exactly, but how many are there? I mean, you named 3. Do we know of any others?
Of the classes of medications?
Yes.
Oh, so those are the big ones.
Yeah.
Finasteride, Accutane, and SSRI medications. And these days, those medications are handed out like candy without informed consent.
And before we run
Yeah.
out of time,
Yeah.
we never got the Ron story.
Yes. Yeah.
Okay.
So tell me, this goes back to how you became permanently the head.
Yeah. So they
I
asked
wanted
me
to introduce who Ron is again, so they understand.
There's Dr. Ronald Gilbert. He was the head of urology at Hoag Hospital, Newport Beach, and he was a practicing urologist. And he knew that someone came to him for ED. He had many different options. They came to him prostate issues, incontinence. He had many different options. They came to him with PE. He goes, I'm either going to put you on an SSRI. We just discussed those horrific side effects, or I got to give you something that's going to numb you and your partner up, where you're not going to have enjoyment. So he went on this journey and found an inorganic PhD chemist who developed this formulation. So then he and I got together, and I said to him, okay, you are going to be he was the type of doctor that he was giving it away. I want people to try it. I go, this is a business. We have investors, okay? We have to eventually start selling it. You know what I mean? I don't want to break your bubble or anything, you know what I mean? But I didn't throw $600,000 of my money in here to be a philanthropist, okay? I'm not Gandhi, okay? I'm generous, but at some point we got to make a business out of this. So we decided he was going to be the medical half and I'd be the business half. So I took the company in a completely different direction, hired some medical reps. Things started to go really, really well. And the company really started to progress. We got our first substantive offer for the company in 2013, January 25th. And I'll never forget, he came over to my house. We talked to some of our investors, and they're like, oh my God, we're going to take it, because it was like 5X what the rounds of investment we had taken in. And I said to everyone, anyone who wants out, I'll buy you out at that price. They're like, what? They go, why would you do that? I go, we have a long way to go. This company has legs, trust me. And I'll never forget, they go, well, you're the guy that did it. If you believe in it, we'll hang in there. And I go, yeah, we have a lot further to go. So I'll never forget, we walked outside. He had this little convertible Lexus. And he goes, I love you, brother. You made my dream a reality. And his wife had told me at Christmas, because they had me over for Christmas to their house, she goes, Ron is so happy now. He goes, for the last 2 years, he's been frustrated. You know, I have this great product. This company's not going anywhere. And he goes, now he comes home. He goes, one of my best friends came and took this company. And now I feel we're on the right track. We really have a handle. And I told my son, we were driving home, and I said, that makes all the difference in the world. Can you believe it? He's happy now. He's a great dude. You know, he's a better father, you know, because he was frustrated. So he goes, I love you, brother. You made my dream reality. I give him a big hug. He drives away, right? Next morning, he sends me a text message. He goes, I can't thank you enough. He goes, I'm so happy. I go, we still on for lunch? He goes, yeah. And I said, fasten your seatbelt. I said, this ride's just getting started. Wasn't an hour later, I get a phone call. One of my very good friends, his wife is a nurse at Hoag Hospital. He goes, you sitting down? I'm like, yeah, in my office. I go, why? He goes, Ron got shot. I go, Ron who? He goes, Ron, Dr. Gilbert. I go, got shot. He's at Hoag Hospital, Newport Beach. For those of you who don't know, Newport Beach is like Beverly Hills. There's no crime in Newport Beach, you know? Maybe somebody jaywalking, okay? It's like one of the safest places in the world. I go, what are you talking about? He goes, he got shot. I go, is he okay? He goes, no, he died.
Oh, my God.
I go, I just talked to him an hour ago. He's in his office. It's Hoag Hospital. And I said, that's impossible. So I hung up the phone, and I was like, something's really weird here. So I called his cell phone. It went right to voicemail. Called his office phone. It rang, went to voicemail. And then even before I'd hung up the phone dialing his office, my cell phone rang, and it was Yoshida, his partner, Dr. Jeff Yoshida. And I was, it was a bad sign. I remember I answered the phone, and he goes, Jeff, this is Jeff Yoshida. And I'm like, yeah. He goes, I'm here with the Newport Beach Police. He goes, it's true, Ron was murdered. And I'm like, what? And he goes, it's total lockdown. We're not allowed to talk to anyone. But I told them this is his partner, his best friend, and everything else. And he goes, we'll talk later tonight. And I remember I dropped the phone, I swear to God, and I was like, I couldn't process it, you know? Did you ever see the movie Saving Private Ryan? You know, the one with Tom Hanks? You know the part at the end where he's defending the bridge? It's the very last part, and he's trying to wire the thing up, and all of a sudden that tank shoots that percussion grenade and hits the building, and he falls back, and he goes completely unconscious for a second. Then he comes to, and everything's in black and white, and he can't hear, and everything's in slow motion. That's exactly what happened. I was sitting there, and I remember just rocking, and everything was like in slow motion. I couldn't hear. And I remember going like this and pinching my arm. And I'm saying,
wow,
this can't have happened. And for whatever reason, I flicked on the TV, the local Southern Cal news station, Channel 3, and it showed SWAT teams all over Hoag Hospital. I'm like, are you freaking kidding me? I'm like, oh my God. I'm like, what just happened? And I just remember sitting there, and it felt like all the air was sucked out of the room. I couldn't hear, and it was like, I just couldn't process it. And I remember every day that I woke up after that, the first thing I'd do is to wake up and go, I think I was dreaming, you know? Then it would hit me, no, I wasn't dreaming. It actually happened. So in March of that year, that happened on January 27th in 2013. In March of that year, I was in my office. I said, I can't do this anymore. I'm just going to have someone else run the company. I'm just going to quit, you know? I started crying. I was so upset. And then it came to me, I said to myself, I can't unring that bell. I can't bring him back to life. That's not in my power. There's two things that I have control over. Number one is his legacy. Number one is to give him a legacy and make him proud. Number two, his family still own 20% of the company, is to provide for his wife and his children. And right there I said, I'm not going to run away. I said, I'm going to make this company successful, and I'm going to honor him. And he's going to be on our website forever. Every time I do an interview podcast, he's going to be mentioned. And people will say to me, oh, you're a genius, you did this. I go, this is his. There's a lot of business people, but without this product being clearly superior, it's still the best option today, 12 years later. There would not be the success of this company. A lot of people could do what I did. Now, I'm tenacious and I work really hard, and I've worked basically without a salary or whatever else just to kind of give him that legacy and to provide for his family. And I've been very fortunate because we're very profitable now, and I've given them every quarter, every 3 months, fairly significant dividend checks. Because
so what is the status right now of you and the company, and also who killed him? Those are my two questions.
The guy that killed him, his name is Stanwood Elkus. This is insane, okay? He was a guy that had a prostate surgery 23 years prior to that, so it's 35 years ago now when that happened, 2023. He was unhappy with the results of his prostate surgery, and not that in 1990 there was any guarantee of any certain result, but he decided that he was going to kill the doctor who did his surgery. So he went to the VA. It was a VA surgery. He said, I'm going to find the doctor that did my surgery. So the VA headquarters, or the VA place he went, they said, we don't have the results or the
Operative
notes here. It's at the VA headquarters in Long Beach. So he went to the VA headquarters in Long Beach. It was on microfiche. Remember what microfiche was? Where you had to kind of go, this is before your time. Before they had the internet and everything, computers, you had to scroll through and look. So he goes there. The guy did the surgery was named Dr. Ron Gilbert. He was a urologist in Newport Beach. Somehow he does an internet search and decides he finds Dr. Ron Gilbert. That must be the guy that did the surgery. So he made an appointment to see Ron and had a backpack and had the gun in his backpack. So when Ron went in to see this patient, he was waiting in a shooting position and shot him 8 times through the heart in the doorway and murdered him. So
And it was the wrong doctor.
Wrong doctor. Ron did not do the surgery.
Oh, my goodness.
And for those of us who loved him and knew him, I think the craziest part was, I tell this to people, it would be no less tragic if he was killed in a car wreck or a plane wreck, but it'd be easier to comprehend and take because you go, it's one of those fates, oh my God, whatever you believe, that happened. But for those of us who really cared for him and loved him, you're left with a feeling, not only could he be here, he should still be here. Somebody knowingly and willingly decided to take his life without even, not that the guy that did the surgery deserved to die, for God's sakes, but the crazy part is the guy that did the surgery died of a heart attack 2 years before he killed Ron. So if he would have at least done his homework, he would have found out the guy that did the surgery was gone.
Yeah.
And, we've had a lot of success. And people always tell me, aren't you so happy? Yeah. And I used to tell them up until 2 years ago, yeah, but I wish Ron could see this. Oh, my God. I used to tell everyone, can you imagine, Ron
So this happened in 2023?
No, 2013.
Right. So right now, so you're still running the company.
Still running the company. We are in active talks right now with some major companies that want to take a major stake in our company and take us to the next level. One of the things that we deal with all the time is it's not a level playing field. Everyone likes to think that everything's level, everything's fair. It's not, okay? We deal with issues that are insane, whether Google comes in and says, oh, this is a pornographic product. What do you mean? We have a freaking advisory board. We're medically certified. We have clinical trials, but they put you in and our ads are all classy. They're doctor focused. Somehow they put you in these categories you're not allowed to advertise. We get taken down on Instagram. We get taken down on Facebook. We deal with issues all the time. We're currently #1 best-selling sexual enhancement product on Amazon. But 7 times in the last 5 years, we've been taken down for 2 months at a time on Amazon, and we do huge business. We do $20,000 a day on Amazon. They will take our listing down and go, oh, this is a product that requires a prescription. We're covered under an FDA monograph. Here's the thing. And then the crazy thing is we go through it again 8 months later, and you're like, wait a second. But these big companies have a dedicated rep because we do $5 million a year on Amazon. They do $100 million a year on Amazon. So they have a dedicated rep. When that happens with them, they make a phone call. Boom. In some cases, it doesn't happen because their rep is looking at the account. We deal with so much nonsense that it is insane being a small company, especially when you're in sexual wellness. I'm sure you run into this even with YouTube and some of your videos.
Well, I didn't realize that I was shadow banned on Instagram until someone taught me how to check. And then I realized no wonder my content wasn't getting a lot of views. I had 10 pieces of content that were flagged.
That's exactly what happens.
Are we going to get flagged today?
No, because of you. There you go. That guy's a legend. I've heard of him. You know what I mean? Half the sexual wellness specialists
That's
were
why
his
we
fellows.
have you here, Larry. We just need to keep this
I'm only
video on
here
YouTube.
so we don't get flagged. That makes me feel
He's our
great.
insurance. He's our insurance, our safety valve. But it's crazy. And so I want to take this to the next level. And I really and truly, and it's channel power. It's called channel power. We fought our way into all these stores. But there are products, and sometimes our competitors come up with a product like Trojan did with that 30-year-old product. They walk in and go, put this next to that. They have 18 products in sexual wellness. So we have to fight our way in, and finally people are looking at the results and going, oh my God, I got to get that. Look at how they're selling. But we would love to have the opportunity that a lot of these companies do, where they just, because of their channel power, because of their might, because at Target they're already doing 150 million as opposed to us doing 3 million, that they develop a new product. They just go, slide that over, put that in right there.
Well, we know today is going to help.
It will help. Today will help. My association with the legend, with the Godfather.
And I'm not going to call myself a godmother, but maybe a grandbaby.
Yeah, grandbaby.
I like godmother. I like godmother.
Godmother. Yeah. Well, that's why I find this combination so intriguing. I told you guys when I came in, because you guys are obviously different genders, different generations. You know what I mean? And it's
Good pickup.
I'm really astute. You know what I mean? I had to study for a while. You know what I mean? But it just hit me sitting here. You know. But I think that's what's great about this, because you bring two different dynamics and certainly two different audiences in a separate set. Now you have a lot of colleagues, okay, that are similar in the business, but you really do this to educate, not colleagues. Colleagues already know what's out there. This hopefully brings a lot of lay people, a lot of people.
Yeah, that's what we'd like to do.
Yeah, we're just searching for more information to have better intimacy.
Because this is not out there for everybody. So this is going to give you good exposure and also help a lot of people.
At the end of the day, I took a lot of criticism when we first put our website up. People go, are you trying to sell product or educate people? I said both. But I said, let me tell you something. Here's my feeling. The more information you have, the more educated you are, the more likely you are to buy Promescent. And every other competitor we have, you go to their website, all it is every time you go to Flickr, don't leave, 20% off, don't leave it. We have studies that you have to leave the site and then come back. We have situations where there's blogs that talk about even sexual products that we don't sell. We want to educate. And I tell people, the reason we've been successful and we grow every year, because when I took over the company, we were doing $80,000 a year. This year we'll do $14 million. Next year we're on target to do $20 million, because a lot of these retailers are just coming on halfway through. Because what I want, this is my goal. I tell people, no matter where you buy our product, whether it's on retail, Amazon, our website, start at our website, because there's so much education on there. And the reason I want people to start at our site, I want you to buy the right product for the right reason, so that you have the highest chance of success. But just as importantly, I want you to use it and dose it correctly. So our goal is not to have a bunch of people try it and never come back. Our goal is to have this core group of people that try it, like it, and continue on, and then start adding other products and start telling their friends. That, to me, is the best business proposition you can have. Build a core that are loyal, that appreciate it, that realize you bring value, a value proposition, so that the growth is organic. And that's.
No, I'm sure there are people watching right now who are on their way to the store.
Jeff, I love your mission of helping people have ridiculously good sex.
I know in my life that whenever I'm sexually active and in a good relationship with good intimacy, I swear to God, music sounds better, colors are brighter, food tastes better, that kind of thing. And there's this adage that I tell people all the time, and I never figured it out until I got involved in this industry. Did you ever hear it? I know everyone's heard this. Someone will say, when I'm in a great relationship, everyone hits on me, whether it's a guy or women, and everyone really wants me. When I'm not in a relationship and I'm kind of down, I can't buy a date. There's a reason for that. When you're in a good relationship and you feel pleasured and you feel like you're satisfying your partner, you give out this aura of, I'm positive, life is good, and people go, I want a piece of whatever that is. That guy looks, or woman looks comfortable and happy and satisfied. When you're not in a relationship and you're kind of walking around with your shoulders slumped and you go, why can't I find a date? People go, I don't want a piece of that. What's going on with that? That guy looks, or that woman looks like she's mad at the world. And it just hit me about 10 years ago. I go, that's exactly what that is. When people go, when I'm in a relationship, I can't literally beat them off with a stick. Everyone wants me. When I'm not in a relationship, I can't find a date.
On that note, Jeff, thank you so much for joining us today. I always learn a little bit of a great nugget every time we chat.
Yeah, me too. It was really, really good for me.
It's a pleasure. I can tell you this. I don't hold very many people in as high regard as I hold both you. And that's why I was shocked and also very happy when I saw the two of you partnered up. And then when I got the opportunity to be here, I was like, what time, where, I'll be there. You know what I mean?
Well, we really appreciate
that decision.
Thank you
took
so much.
1 second. Yeah, thank you. The pleasure's all mine.
Larry, I love Jeff. I mean, I love you, but I love Jeff.
I got jealous there for a second.
Because as I described during the episode, Jeff has changed me as a person, personally and professionally.
Yes, you gave a very personal attestation
I
there.
did. I was very vulnerable.
Yes, you were. I was very proud of you.
Thank you. What did you take from today's episode?
Well, I mean, I think Jeff is just an amazing person. His enthusiasm for what he does and for the space is contagious. And what a great personality. I just thought it was a really, really entertaining and very, very thought-provoking episode. Okay.
All right, Larry. So what's today's final F word?
Well, after many hours of thought, I've decided it's going to be phallus, but I don't want people out there to think that that's how I spell phallus. But it's not with an F.
All right, we got the PH again.
It's a PH,
taking
which
some
is
liberties.
phonetically F.
All right, Larry, why don't you give us some foreplay for our next episode?
Okay, foreplay for the next episode is going to be a very entertaining but also educational visit with Aaron Spitz, who is currently writing a new musical entitled Conversations with My Penis. Don't want to miss it.
Thank you for joining us today on Fertility and Other F Words.
And don't forget to like, subscribe, and comment.
Until next time.